Good morning, everybody. Welcome to the next installment of our 13-week series on the secrets of a successful retirement. Tara and I are having a lot of fun putting these on various topics. And today's topic is an important one. As we enter into retirement, most of us will be on and covered by Medicare options. And understanding those is critical because if you spend any time in a hospital these days, in just a matter of a few days, you can run up $100 or $200,000 or $300,000 bill, and with the right coverages, you can protect yourself and have a safe, secure retirement. So today we're going to focus on understanding Medicare options, and we're going to talk about ways to save on prescription drug costs. Two really important topics. Uh, how do we help? Senior Resource Center focuses in four different areas. We do comprehensive retirement planning, and by that we mean we build 30-year plans for our clients so that their money will last as long as they do. Nobody wants to be 85 and greeting at Walmart. So uh, building a comprehensive retirement plan gives you insights into where you'll be financially down the road. We do tax planning, not tax preparation. And by tax planning, we found that people are paying lots and lots of money in taxes, and we found legal ways to help them reduce that tax burden. Long-term care planning is a critical topic in retirement. It's probably one of the biggest risks we're going to all face as we age because we're living longer and the cost of care keeps going up. And so next week, we'll be having a webinar at the same time, and it'll be focused specifically on ways to pay for long-term care without taking it out of your own pocketbook. And finally, we do estate planning. And very simply, that means safely passing assets to the next generation and avoiding probate, which is a legal process of transferring assets. So with that, I'm going to turn the webinar over to my partner, Tara Kendrick. Tara, take it away.
All right. Hey, good morning, everybody. Thanks for joining us. If you do have any questions, don't forget to use the talk bubble at the top of your screen. You can type in a question and we will get through all those questions at the end of the webinar. All right. So when it comes to Medicare and healthcare in retirement, most people rely on Medicare as their healthcare when they retire and when they leave group health. And so what's really important is understanding what options you have to make sure that you do have a safe and secure retirement, whether it's that you're continuing to work over past age 65 or you want to retire early and get on Medicare. It just depends on which avenue you're going to take, what makes the most sense. Okay, so in today's topics, we're going to cover what is Medicare, what your options are in 2021, how to enroll in Medicare. Then we're going to go over some employee choices. So if you're still working, what choices you do have as an employee. We'll get through some tricky situations. There are some kind of potholes in the road that we want to make sure you understand and don't have to encounter when you're making your choice. And then we'll take your questions at the end. So, what is Medicare? Medicare is health insurance for those who are over the age of 65, under 65 with certain disabilities, and then those who have end stage renal disease. It's managed by the Centers for Medicare and Medicaid Services, and then it's augmented by private insurance companies, and that would be your Medigap uh, Advantage plans, supplement plans. And you can sign up for Social Security at ssa.gov. Okay, so this one chart is what we're going to focus on today. We have a lot of families, a lot of people who come in and they say, oh my gosh, I'm turning 65 in 3 or 4 months. I am getting constant phone calls. Every time I go to my mailbox, I have more and more mail, and I am so confused. And so we came up with this one page that we can explain Medicare and what your options are. And so we're going to go through this today, and this makes it a lot easier. And then you can stick all of that other stuff in the trash and make your own educated decisions. All right. So Medicare has two building blocks, and that is your Medicare Part A and your Medicare Part B. Now, Part A is going to cover your hospital costs and your short-term nursing home, or what we would call short-term rehab. And that's your first 20 days, say, in a rehab facility. It is free, so there is no premium, but you do have a deductible, and it's based on per event. Then you have Part B, and that's going to cover your doctor visits and your lab work. Now, that one does have a premium per month, and this year the basic premium is $148.50 a month, but there is also an annual deductible, and then you have an 80/20 copay. So when you turn 65, if you want to do nothing else, you would sign up for Part A and Part B, and you would pay the $148.50 a month. Now, there are some holes. You can see there's deductibles, there's copays, and that's where the private insurances came up with what they first called a Medigap program, or they called a Medicare supplement program. And what that is that's filling in those gaps. It's paying those copays, it's paying those deductibles that are not covered by Part A and Part B. This year, there are 11 standard plans, A through N. So you can choose one of those. Now, here is a chart of A through N. Looks a little overwhelming, but I'll explain that we pretty much tell our clients to choose one of three options. So the best option that's out there with the Medicare supplement plans is Plan F. And the good news about these supplement plans is it doesn't matter if you go with United or Aetna or Blue Cross Blue Shield. They're all the same. So every plan is going to be the same regardless of what company you get it. So if I get Plan F with Aetna, I get the same coverage as if I get Plan F with United Healthcare. The difference with Plan F, though, is you have to have turned 65 by December 31st of 2019. And this is the one we say it's a bulletproof plan because, as you can see, if you go down the column, 100% of your coverage is covered on all areas. Now, if you're turning 65 this year or it was after 2019, then the next best plan is Plan G. And the only difference is if you look down at the Part B deductible, that was not covered with Plan G. So let's say you get the new plan, you sign up, you go to the doctor for the first time. They're going to ask you for that first deductible, the $203. After you meet that $203 deductible, you have no copays, you have no out of pocket. So you can leave your checkbook at home. And that means a doctor's visit, or it could mean triple bypass surgery. It could mean, cancer coverage, whatever it is, you're covered at 100%. So you're paying your monthly premium for that supplement plus your $148.50 for the Part B, and everything else is covered. Now, if the cost of the premium for your supplement plan is more than you can afford, the next best one is Plan N, and that's on the far right. And it has a little more exposure. So you can see there's a $50 copay if you end up in the emergency room. And then each time you visit a doctor, you're going to have a $20 copay. But after that, and your Part D B deductible being met, you're covered at 100%. So those are the three that we highly recommend. And we're not going to talk about specific products today. We're just going to talk about the overview of how Medicare works and what the options are. All right, so now you have your A and B, you got your supplement to cover those exposure points. Now you need to get a prescription drug plan. And Part D was rolled out in 2006, and this is an annual plan. What that means is it goes from January 1st to December 31st. So a supplement plan is a lifetime plan. So once you get on that plan, you never have to get off. As long as you pay your monthly premiums, you stay on for life. With a Part D prescription plan, you actually want to review your plan every year and see if you're on the best plan, because it will change from year to year based on the drug tiers and based on where that particular company puts your drugs on their list. So one of the great websites that the government did a great job with is Medicare.gov. And so what you want to do is every year during open enrollment, which is October 15th to December 7th, you're going to go on Medicare.gov and you're going to create an account. And in that account, you're going to build your drug list, name, dosage, frequency, and then you get to select up to 3 pharmacies. So you'll just select within your area, say your local HEB, CVS, Walmart, wherever you normally go. And then what it does is it ranks the drug plans in your area, and there are 35 plans in 2021 in Texas, from the lowest annual cost to the highest annual cost. And what that means is you don't want to look at copay, you don't want to look at premium. You want to look at how much is your out of pocket for the year, and that's your annual cost. So, of course, at the top of the list is going to be the least expensive. So then you easily will go on there and you'll hit the Enroll Me button, the one you choose. And if you were already on a plan from the year before, it'll automatically disenroll you from your current plan. And the new coming year, January 1, you'll get on your new plan. And I will say this is very beneficial for you to go and double check. I mean, even if you love your plan, everything's been wonderful, you have had no problems, it's always worth checking, because we've had families that have come in and they're like, oh, we're fine. We don't need, we don't need to look. And we'll say, let's just look and see. And so we'll get on their account and we'll look again and we'll run it for the new year. And their plan will now be 6 or 7 down from the top, meaning that they may have, $200, $300, $1,000 more out of pocket if they stay with their current plan. And instead, they can switch to the plan at the top of the list, which saves them a ton of money, because, you need to be loyal to your wallet and not loyal to your plan when it comes to drug plans. And if you need help with this, we don't sell drug plans, but we're happy to help someone walk through the website if you need additional help in doing that. Now, on the right side of the page, we have what's called Advantage plans. And Advantage plans are a privatized insurance of Medicare supplement plans, or Medicare. You still have to be on A and Bs. You have to sign up for A and you sign up for B, but then you get on what they call a Plan C plan. Advantage plans can be good if you don't have a lot of money and you want low monthly premiums. The downside to that is there are a lot of exposure points. There are copays, there are deductibles that are sneaky. So you might pay $20 a month and think, man, I'm getting amazing healthcare coverage for super cheap. But then you end up in the hospital and you need some major surgery, and now you're having to pay 20% of that bill. So you really want to be careful. The other downside to Advantage plans is many of them you have to be in network, which can mean that you end up having to go to different doctors than you want to go to. You might not be able to go to the hospital you want to go to. If you have to go to the hospital and then you have to rehab somewhere, your Advantage plan might not be the one down the road. It might be the one across town. So there are some, sticky places that Advantage plans aren't as good as, say, a supplement plan that you can go anywhere Medicare is take anywhere they take Medicare. So pretty much all doctors, all hospitals, all rehab facilities. Where Advantage plans, they're going to have a very limited number of places and people that they work with. So just be careful when you're looking at those Advantage plans. All right, so now I'm going to give the helm back over to Bill, and he's going to take us through the next slides.
Let's talk about enrolling in Medicare. And to enroll in Medicare, you need what's called a triggering event. And there are 3 basic triggering events. One is turning 65. And there we have a 7-month period, the 3 months before your birth month, the month of your birth month, and 3 months after. And coverage starts the first of the birth month. So let's say I'm turning 65 in June this year, June 10th, let's say. Well, I sign up for Medicare, and my coverage would start on June 1st and continue on. The second triggering event is when I drop group health. Many people today are working past age 65, and they elect to stay on group health plans. Well, when they know that it's time they're actually going to retire, then they have a 63-day window after dropping group health. But we always suggest, well, don't have a gap in coverage. So if you know you're going to retire, let's say June 30th of this year, go to HR and there's a form you can fill out that says, I've been covered by group health since I turned age 65, and I'm losing coverage, say at the end of June. And that's a triggering event. The loss of group health is a triggering event. Once again, I can tell Medicare when I want my coverage to start, and so we can have a seamless transition from group health into Medicare. The third uh, triggering opportunity is the general enrollment period each year from January 1st to March 31st. So let's say I turn 65, I don't sign up for Medicare, and then the following January 1st, I go to the SSA.gov website and sign up. My coverage would start the following July 1st. So there can be gaps in enrollment, but the general enrollment period is the third triggering event. So let's talk about employee choices. As I mentioned, many people are working past age 65. And a lot of times people contact us and say, Bill, should I stay on group health? Should I drop group health and switch to Medicare? So let's look at two different scenarios. If your employer has less than 20 employees, let's say you work for a small firm with less than 20 employees, then Medicare is primary. And so it's a good idea to go down and sign up for both Medicare Parts A and B, even if you're going to stay on group health. Why is that? Well, let's say you have a major event, triple bypass or a cancer treatment that runs up into tens of thousands or millions of dollars. If you haven't signed up for Medicare A and B, and Medicare in that case is primary, then the group health plan could say, well, gee, we'll pay after Medicare pays, but since Medicare wasn't signed up for, it isn't going to pay, and the group plan can decline coverage. If your employer has more than 20 employees, then the group plan is primary. And then in that case, usually signing up for Medicare A, which is free, is a good idea, but you wouldn't want to sign up for Medicare Part B. Why is that? Because you'd pay a monthly premium for Medicare B, and unfortunately, you'd probably get no benefit from it because you'd have to exhaust all of your group health coverage before Medicare B would come into play. So if you're going to stay on group health past age 65, signing up for Part A is a good idea. Signing up for Part B is not a good idea. The other option people have when they're beyond 65 is you could drop group health and enroll in a full Medicare solution. Why would you want to do that? Well, let's say I'm turning 65 or I'm turning 65 and I know that I'm going to have an expensive medical treatment this year, knee replacement surgery, cataract surgery, or some other medical event that's expensive. And let's say my group plan has a $3,000, $4,000, $5,000 annual deductible. Well, I know I'm going to hit that because of this expensive event. So sometimes switching to Medicare can be a way to say, okay, I know I've got that surgery coming up. I sign up for Medicare Parts A and B. I add on a Medicare supplement, as Tara described, and then a prescription drug plan, and I'm pretty much bulletproof. I don't have to worry about a large out-of-pocket exposure. The other option is I could sign up for Medicare Parts A and B and sign up for an Advantage plan. So lots of options. Tara and I don't tell people what to do. Our job is to educate and say, look, here are your options. Here's the pros and cons of each option. Which one feels right for you? So let's talk about some tricky situations that Tara and I have run into over the years. The first one is health savings accounts. We're going to look at that. Second one is COBRA, continuation insurance. Third one is what if your spouse is younger than 65, but you're 65 or older? Fourth one is high drug costs. And then we'll touch on some high income surcharges that apply to parts of the Medicare coverage. So the first one is health savings accounts. And in very simple terms, many people today are on these high deductible HSA accounts where either they or their employer is putting pre-tax dollars into a health savings account. Well, here's the rule. You can't be on any form of Medicare, either A or B, and make pre-tax contributions, either you or your employer, to a health savings account. If you do, there will be a tax penalty. So think of it as water and oil. Oil and water don't mix. Well, the same thing is true. HSAs and Medicare are not a good combination. You're either on one or the other. So where does it get tricky? Well, we've had folks that waited beyond age 65 to sign up for their Social Security benefit. Let's say I've been working, I'm on group health, I'm on an HSA account, and I now at age 68 decide I think I'll claim my Social Security benefits. Since I'm beyond age 65, what Social Security does is they automatically retroactively date my Part A coverage. So let's say I just turned 68, they set up my Medicare A coverage as if I had signed up for it at age 67 and a half. But I've been making contributions to my HSA during the last 6 months. Once again, I'll have a tax penalty. So if you're on an HSA, you like it, you want to stay on it, don't sign up for Parts A or B. And then when you know that you're about to get off, or when you know you're going to sign up for Social Security, you want to stop contributions to the HSA, both you and your employer, 6 months before you elect your Social Security benefit. If you have questions on this, give us a call. Consultations are always free. Okay, the second tricky situation is COBRA. What is COBRA? Well, it's continuation health insurance after you leave employment. And where does this fit in? Well, let's say I'm on an employer group plan and I'm 67, 68, and I'm getting ready to retire and I'm familiar with my group health, but I haven't studied Medicare very much. And I go, well, I'll delay the decision on signing up for Medicare. I think I'll try out COBRA. Well, the problem with that is if you sign up, if you get on COBRA, when COBRA ends, it is not a triggering event. Remember, you need a triggering event to get your Medicare A and B started. And so if let's say I'm on COBRA, and let's say it ends June 30th of this year. So I trot down to Social Security office or I go online, try to sign up for Medicare A and B, and they go, well, Bill, you don't have a triggering event. You're going to have to wait till the next general enrollment period, which isn't until the following January 1st. And your coverage won't start till the following July 1st. So now I'm going a whole year without coverage. That doesn't feel good. Now I'm exposed. On top of that, because I didn't sign up for Medicare A and B when I was supposed to, I'm going to have late enrollment penalties for both Medicare Part B and for my prescription drug premiums. So where does COBRA fit? Let's say I'm 66, I sign up for Medicare A and B, my spouse is only 63. If you're younger than 65, COBRA can be a good bridge to help you get into Medicare coverage. So it works as for people younger than 65, COBRA is fine. People older than 65, COBRA is not a good fit. And that's what we were just touching on. Let's say my spouse is younger than 65 and I'm older than 65. I sign up for Medicare, I get off group health, but my spouse is going to lose coverage because I'm no longer active on the employee group plan. Well, there's several options, and this is one where COBRA does fit very nicely. If you have less than 20 employees, the state continuation of the group plan is for 9 months on COBRA coverage. If you have 20 plus employees in your employer, then COBRA can be either 18 or 36 months. And that can be an important bridge to get your younger spouse to age 65 where they too can sign up for Medicare. So what if COBRA can't get my spouse to age 65? Then your spouse would want to look at possible coverage under the Affordable Care Act, ACA, or they might want to get an individual health insurance plan. Once again, because medical care is so expensive, we can't afford the risk of dropping coverage and flying without coverage because one trip to the doctor's office or into the hospital and we could run up a huge bill, which would dent our retirement savings. Another sticky wicket is high drug costs. And why is this a problem? Well, I want to compare our drug cost plan to other countries like Canada. If you go to Canada and go to a CVS or a Walgreens or a Walmart and you get Lipitor or some drug, the price will be the same at each one of those outlets. Why is that? Because they have nationalized health care. where the federal government in Canada has negotiated set prices for individual drugs, and the same drug is available at that same price wherever you get it. Well, that's not true in the United States. Here, if you go to Walmart or Walgreens or CVS, you're going to find that the price you pay is based on what that supplier, that pharmacy has negotiated. And so it's much more confusing to get drugs in the United States. You have to get smart, you have to shop. And when they designed these plans back in 2006, they added something that was really horrendous. It was called the donut hole. What is that? Well, if you look at the way you pay for prescription drugs under a Part D plan, there's a deductible phase that some plans cover, some don't. Then there's the initial coverage phase. Then there's what's called the donut hole, where you pay more. And then finally, there's the catastrophic, where you pay a small percentage of the cost of drugs. And the donut hole was very confusing. Getting into the donut hole was based on what you'd spent on drugs. Getting out of it was based on a whole nother criteria. So people were very frustrated. They would get on a prescription drug plan. Everything was great. They'd be paying $30 copay maybe every month. Get to June, July, August. If they entered the donut hole, the cost of the drug might go up dramatically from $30 to whatever the retail price was, maybe $160 or $180. So the donut hole was really a mess. Well, fortunately, the Affordable Care Act has phased out most of the donut hole. Today, when you hit the donut hole, if your drug costs exceed $4,130 in a calendar year, you enter a zone called the donut hole, but your cost of the drug should only change modestly, if at all. So the donut hole has pretty much been eliminated. That still doesn't ease all the pain, though, on getting prescription drugs. So here are ways that we found to minimize drug costs. First, when I enter a doctor's office and the doctor says, Bill, I'm going to put you on a new drug, I always ask the doctor, is this a brand name drug or is it generic? You might be surprised, but oftentimes the doctor doesn't know. Why is that? Because who calls on physicians to sell or represent drugs? Drug salespeople. Well, there are brand name drug salespeople. There aren't any generic drug salespeople. So the doctor is familiar with the brand name. He or she may not be aware that there's a generic equivalent. Now, I want to save money, so I always ask my doctor, is there a generic alternative to this drug? Usually they'll leave the office for a minute, call their favorite pharmacy, ask their favorite pharmacist, is there a generic alternative to Lipitor or whatever the drug is? And if there is, they come back and write a script for that. And I'm not a doctor. I can't suggest asking for generic drugs, but usually they're much less expensive. And I think, there's chemically, they're supposed to be the same. So we recommend at least inquiring. Second, ask for free samples. What do doctors have in their office? Brand name free samples. So if you're approaching the end of the year and you might hit the donut hole or you might be out of pocket, never hurts to ask for free samples. Also, most of the drug manufacturers, to maintain good public image, you see in their ads, if you can't afford your medication, contact us directly, and you can buy direct from Pfizer or Merck or the drug manufacturer and often pay a fraction of what the retail cost of the drug is. Another option that actually Tara shared with me and that I use whenever I go to the pharmacy, Tara shared the Good RX strategy. And that's an outfit that has negotiated discounts. And it never hurts when you go to the pharmacy and they go, Bill, your copay today is going to be $150. My question is always, what's the Good RX price? And there are other sources like Good RX. This is just an example, but it never hurts to ask the pharmacist, what's the Good RX price? Tara shared an experience where one of her children was taking a drug that was in the $150 range. And she said, what's the Good RX price? And the Good RX price was like $70. That's a nice savings. So always never hurts to ask for what your alternatives are. The challenge here is drug costs are a mess in this country. And unfortunately, we can't do what the Canadians do, which is go any place and get the same low price. We have to shop. And one of the advantages, Tara mentioned the annual enrollment in Medicare drug plans. Years ago, I had a lady call in November and she said, I got your newsletter this this month. By the way, our newsletter is free. And it says I'm supposed to go to GoodRx. I'm supposed to go to Medicare.gov to see if I'm on the most cost-effective plan. And her comment was, Bill, I like my plan. And I told her I like my plan too, but I like my wallet even more. And so I told her how to navigate the Medicare site. She did. When she got to the last page, she got confused again because there were different copays, different deductibles. She called back and said, Bill, how do I pick a plan? And I said, look at column 2. You see where it says annual cost? Yes. Well, that's the total cost you'll pay over the next 12 months. And I said, is the plan at the top of the list the one you like so much, the one you're on? And she said, no. And I said, well, scroll down and find your plan. So she took a minute or two. And I said, did you? She said, I found my plan. I said, well, good. What's the annual cost on it? And it got real quiet on the phone. And the top plan, the one she had mentioned first, had a $1,600 annual out of pocket to her. When she got to her plan, the cost was $3,500. By switching, she saved a bunch of money. And so, yes, I like my plan, but I like my wallet better. Always good to shop. It's amazing. I've switched plans 3 of the last 4 years, not because I was dissatisfied with the plan, but because I could save $200 or $300 or $400 by switching. Our final tricky area has to do with income surcharges. There's two parts of Medicare that are subject to surcharges. Tara mentioned that the Medicare B premium this year, most people pay $148.50 a month to be on Medicare B. But if your adjusted gross income is higher, you'll see that the premium for the Medicare B is higher too, both for individuals and for couples. Where this gets tricky is how does Medicare know what premium to charge? Well, they look back 2 years, and so this year they're looking back at our 2019 tax return. Let's say I was working in 2019 earning big bucks, but now my income has dropped because I'm into retirement. Well, if I don't report my lower income, there's a substantial change of life, a life-changing experience form that you can fill out and send into Social Security. And if you don't file that, guess what? You're going to pay a higher premium each month until 2 years have rolled by. So if you made big bucks in 2019, but your income has dropped, you can report lower earnings and get a lower premium on your Medicare B. This is also true of Medicare Part D. If you're on a prescription drug plan and you're a higher income individual, you're going to pay a higher premium. There's a surcharge that's added on each month. And so, once again, file a form. Tara and I have it available in our office. We'll send it to you, email it. You have it filled out. You send it into Social Security, and they will adjust your Medicare B and your prescription drug premiums. Well, we covered a lot of information in a very short period of time. Tara, do we have any questions coming in? Remember, you can type in your questions on top, and we're happy to answer them.
All right, let's see. All right. How do I sign up for our newsletter? That's easy. Just give us a call, send us your email address, or you can stick it in the chat box, no problem, and we will send you our newsletter. So thanks. Okay, next question is, should I leave group health even if my deductible is only $2,000?
Well, that's a good question. If you're on a group health plan, it's very possible your employer is paying all the premium for that plan. And so you're paying copays, deductibles. So once again, we don't recommend staying on group health or dropping group health. What we recommend is put the two plans side by side. What would you pay to stay on group health this coming year? What would you pay to be on a Medicare solution? And you can do your own math. You can add up copays, deductibles, and see which one is a better solution for your situation.
Okay, good question. All right, another one is, can I leave group health at any time, regardless of my age after 65?
And that's a good question too. And that one probably depends on the terms of your group plan. I can't imagine a plan forces people to stay on for an entire calendar year. But I would check with your HR department and ask them, hey, I'm going to stay on group health entering into this next year, but I might want to drop it after 2 or 3 months. Can I opt out at any point in time? Can I leave the plan and switch to Medicare? And this goes back to another point on the prescription drug coverages under Medicare and Medicare Advantage plans. As Tara mentioned, those are annual plans. They start on January 1st, they end on December 31st. So when you pick a drug plan or an advantage plan, you're making an agreement to stay on that plan for the entire calendar year. We've had people come in mid-year and go, hey, I think I want to switch from my Medicare Advantage plan to a supplement to original Medicare. And I go, well, unless you move out of the coverage area, you signed a 12-month contract. You can opt out in the open enrollment period, the annual election period in October to December. You can opt out of your Advantage plan, and your coverage would actually stop on December 31st. So you're pretty much tied to whatever plan you pick for the calendar year. So with drug plans, you want to check to make sure you're on the most cost-effective plan, because once you pass that December 7th window, if you find out later, gee, I could have saved money by being on a different drug plan, it's too late to opt out. You have to now stay on that plan for a whole calendar year. So those were good questions. Anything else, Tara?
No, I think that was it. So next, so the next presentation we'll be doing, of course, it's always on Tuesdays at 10 a.m., is going to be 7 ways to help pay for long-term care. And you can go on our website under events, and you can click on the link and sign up that way. As always, we are going to send you a free copy of our More Money for Retirement book if you haven't already received it. In that email, I'll also send you a recording of this webinar and a link to sign up for our next webinar next week. So with that, we say thank you so much for joining us, and we will see you next week for our next webinar. Appreciate it.
Have a great week, everybody.